Why doesn't this work matter? I mean, we're a wonderful northern community, but we are lacking the resources, so the more services we can offer, the better. I would describe our local healthcare team as dedicated. Between the hours, the passion, and the work they put in, we couldn't ask for a better team. I chose a career in rural health because I really wanted to give back to the community that took care of me growing up. It's home, and I was excited to come back and provide a service that we might need.
I chose the career in pharmacy because I really like medicinal pharmacy, and I chose to come back to rural Alberta because most of my friends all stayed in the city, and I prefer rural Alberta to the city.
I chose a career in rural health because I grew up in this community, in a small rural community, and just kind of saw the impact that healthcare professionals can make in people's lives in small communities. I worked as a student. I had a great opportunity to work with some really great pharmacists and just got to see with their day-to-day, how much of an impact they can make on people, what they can do, how they can fill gaps in the healthcare system, and the relationships that they can create with their patients as well.
So one thing people might not realize about working at a rural clinic is we're very personable. You get to know a lot of your patients, which is awesome, whether they're new or regulars, and being able to help everybody word gets around, and then you become one of the go-to places, and you're able to collaborate together.
So I think one of the biggest things about working in a rural clinic is you have to have more than a specialty. I'm going to say you have to be a little more well-rounded and know maybe a little bit about everything instead of just focusing on one or two things, because you might see way more than what might walk into your practice in a city center. And you also see a lot of people from different areas because we're very central to a lot of areas that don't have service. And so we see people from up to 2 hours away. So sometimes you're just treating people down the block, but here we see everybody.
Something that people might not realize about working in a small community would be just the relationships you get to develop with other healthcare workers in the community. So obviously we have a great relationship with our physicians, we contact them and talk back and forth all the time, but even other healthcare workers, nurses in the area like public health and home care, respiratory therapists. Really, it's a great team environment, and you get to know everybody.
To me, community care is about connection. In our community, you build real relationships with people and work closely with other healthcare providers to help support the community. I want my clients to feel safe and heard during their appointments and beyond it.
So community care to us is very important, and it's very important because we need to create connections and networking within the community, networking with different practitioners, with different people. We see a lot of people in this community, and we do our best to do different volunteering work, fundraising events, sponsorships. Those are all really important to us, and we find that it takes a village to create a community, and we see that here in Grimshaw and surrounding areas, and it's really important for us to be within the community and support our community, because that's ultimately what we're here to do.
I think the biggest thing for me for community care is that this is home. So I'm treating a lot of people that I either grew up with or know. My family's around here, so that's part of it. But it's servicing a community that I think is short on service and being able to give back to them, because there's a lot of different clinics in cities that you can walk down 6 blocks and find another one, and here we are kind of again bringing people from all over, and so to give back to them and to service the people that I knew growing up is kind of special.
What I love about working in a small town is you get to know people more personally with closer relationships than you do in a city.
I grew up in the area, so serving the rural communities is really important to me. Early in my career as an RMT, I noticed there just wasn't enough health and wellness resources in the area. So I decided to open a wellness center to attract more people to the community and offer more services to clients in the area.
Serving a rural area is really important because there can be a lot more barriers to access in the northern communities. There's not a lot of specialists, there's not a lot of different treatment clinical options, so helping to navigate the healthcare system for patients, being their advocate, and just working hard to make sure they're being looked after is a really big important part of our job.